We want to welcome back Dr. Roy Flood, a clinical and interventional cardiologist with SouthCoast Health. Thank you so much for being here.
John, it's a pleasure. I'm glad to be back.
We're glad you're here. And also, we want to remind people, because now we're learning about all these different subsets of cardiology, like what you do. Explain to us the difference. And we usually hear just a cardiologist, but there's so much more to what you all do.
Okay, yeah, let's go into it a little deeper. First of all, so all of us are cardiologists, which means that we have had 4 years of medical school and at least 3 years of training after medical school, and most of us more than that. Different categories. There are non-invasive cardiologists, interpret studies, see patients, so on. There are interventional cardiologists, people like myself, see patients and also do procedures involving wires, balloons, etc., to actually open blocked arteries. There are structural cardiologists, and they focus primarily on procedures and devices which will help to fix valvular heart disease and place different things in the heart to help the heart function better. There are electrophysiologists, and they are cardiologists that strictly work on heart rhythm disorders and heart problems that involve the underlying heartbeat, heart rhythm. And of course, there's a whole different category from cardiac surgery. So we're not surgeons, but...
Right. Well, you keep us alive. Thank you so much for all that you do.
You are welcome. It gets confusing.
That's right. That's right. Well, as we know, when women become pregnant, that's probably one of the most vulnerable health times they have. Tell us about how that can affect the heart.
Well, the heart has to work a lot harder in pregnancy. You're pumping for two, so the cardiac output increases. The heart rate increases. Blood volume increases. So all those things put a strain on the heart, or can put a strain on the heart, particularly if there are some underlying cardiac conditions that may not have been unearthed before.
What are some of the more common cardiac issues during pregnancy?
Blood pressure issues. Persons with valvular disease can have more trouble with their breathing, their heart rhythm. Sometimes non-cardiac problems such as thyroid disease can become more prevalent during pregnancy and will require some cardiac adjustments to medications, regimen, etc. And then there's some more serious cardiac entities such as peripartum cardiomyopathy. And that's a weakening of the heart muscle that is associated with pregnancy. Then there are things like eclampsia and preeclampsia that affect the blood pressure and cardiac functioning in that regard. And that's just a few.
Are there certain women who are more at risk?
Yes, there are. The usual suspects, as we like to say. So persons who suffer from hypertension, diabetics, they're more prone to these problems. The African American women are more prone to disorders of the heart during times of pregnancy. People with family histories of cardiac problems are also more at risk.
Well, we know with the women being so in such a delicate situation when they're pregnant, are the treatments different for them, say if it were me with these same issues happening as opposed to a pregnant woman?
Well, the medications that we can use are more problematic in the case of pregnancy, because remember, anything I give to a pregnant patient, I'm also giving to the unborn fetus. So have to be careful about that, because some of the medicines are not really appropriate for the fetus. So that's really the big thing that we have to take into account, the age of the fetus and where they are in that development and what we can use safely to protect both the baby and the mother.
Is there any advice that you could share for pregnant women when it comes to their heart health?
Well, I think the big thing is knowing your history. If there is a underlying condition, we need to have that under control. I advise strongly that people who are considering pregnancy that have any of those conditions that we listed, get pre-screened, talk to your cardiologist about where you are with the health issue, see what else we need to do beforehand in terms of checking cardiac function, reviewing medications, physical assessment, examination, etc. And typically, if we do those things up front, we're able to avoid problems during and after pregnancy. And it doesn't just stop with the delivery. Some of these things can still be problematic for months after the delivery, so we have to stay vigilant.
And is that considered the postpartum type time?
Postpartum time, the whole time is when the postpartum cardiomyopathy can be an issue. There's also something called spontaneous coronary artery dissection that happens postpartum often.